Okay, good to go.
Good afternoon, everybody. Thank you, good afternoon, everybody. Thank you for joining and welcome. I'm Patrick Kreider. I'm a member of the healthcare vertical at ServiceNow, and I focus on our customer relationship management solution. In today's webinar, we'll be reviewing an innovative AI-powered healthcare referral management solution built on ServiceNow. This powerful solution was developed as a collaboration between ServiceNow and KeenStack, a certified ServiceNow partner. Today, you'll hear from Dr. Greg McDavid, a practicing physician and ServiceNow's Director of Healthcare Industry Strategy, Alexis Delgadillo, Senior Vice President of Customer Success with KeenStack, and finally, Ben Rice, Advisory Solution Consultant with ServiceNow, will take you through a demonstration. A few housekeeping items before we begin. We will be recording this webinar to share with you following today's session. Regarding questions, participants will be muted for the webinar. If you have any questions at all, we encourage you to put those in the Q&A section and we'll look to answer those for you. And so with that, I'm pleased to introduce Dr. Greg McDavid.
Thanks, Patrick. I'm just going to take a few minutes with everyone here and kind of set the stage for the conversation and the demonstration that we're all about to see around referrals and some of the challenges that we see in this space. Just as a practicing physician, give you a little bit of the insight, and hopefully a lot of you are already aware of the struggles that we face, but I'll put a little bit of structure around it. So let's just start with the reality of our situation in healthcare. Every year, our organizations lose billions of dollars due to referral leakage. That means we lose referrals or the business around referrals. When patients are referred outside the network or outside of our kind of closed organizations, or sometimes referrals even simply fall through the cracks if we are referring in-house as well. We just don't have a lot of really clean processes around this. So it's not just a financial hit, it's also a clinical one. Delayed or lost referrals means delayed diagnoses, sometimes fragmented care experiences, and really ultimately frustrated patients. And the most recent studies estimate that about 50% of referrals never result in a completed appointment. And that's a staggering gap in care delivery. Of course, some of those referrals patients choose not to see or not to complete the appointment themselves, but a significant portion of them actually just never get to the point where an appointment is scheduled in the first place. So why does that happen? The root lies in our old manual processes that really dominate our referral space today. So a primary care physician will often fax still a referral to a specialist. That fax gets lost, misrouted, or sits in a pile waiting for someone to manually enter it. Or email referrals get buried in inboxes and they lack standardization around their processes, or they're missing critical patient information. So it creates inefficiencies and bottlenecks. That builds administrative burden and time. And of course, worst of all, it compromises our patient outcomes in some cases. So the clinical pain point is pretty clear. Without streamlined referrals, patients face delays in seeing their specialists. Some of the complexities with that is it can erode trust, and in some cases, of course, conditions. But from a business perspective, referral leakage means lost revenue. And in large system, this could be millions of dollars in lost revenue. So each missed referral is a missed opportunity to keep care within your network, maximize resources, and deliver it on value-based care agreements. The more that we have referral leakage, the less we can really support or maintain our commitments within our value-based care arrangements with our payers. So we can draw a parallel to other antiquated processes in healthcare. If you've been around long enough in this space, lab and imaging orders used to be paper-based and error-prone or phone call-based. So we had faxed lab orders, and if you ever operate in kind of an older facility, you will see vacuum tubes where we still use them to actually send lab samples, but we used to send the lab order itself on paper. And so we've integrated digital systems to drastically reduce our error and speed up result times. Referral management has been stuck in the past a little bit. And now that we haven't tried, some of the EMRs out there have made some pretty valuable steps toward referral management, but those referrals really have to exist within the EMR ecosystem that you exist. Um, and for the most part, our specialty referrals often go outside of our system, or sometimes we are the system with specialists, and so the referrals are coming in from an external system. So the technology to fix this is here. AI-powered referral management built on platforms like ServiceNow can really transform this broken process. We can automate intake, validate documents, use intelligent algorithms to provide actionable insights. AI really streamlines the operation and plugs a lot of the leakage points. So it integrates seamlessly with your existing EHR, orchestrates workflow around it to reduce rework and free up staff for what matters most. And that's actually spending more time with patients or ultimately just giving them time back at the end of their day so they can go home and spend time with their families. So just imagine a world where paper referrals and web forms are instantly converted into a structured health data model with AI-driven quality checks to ensure no details are missed. And and you know, Keenstack has really made excellent strides here with some innovations on the platform to deliver a solution like that using technology on ServiceNow. So with that, I will end my part here, and I'll turn it over to Elifsis. So Elifsis, take it away.
Thank you, Dr. Greg. Appreciate it. So again, just moving into the next slide here, a lot of this content is really just going to reinforce some of the great points that you made around referral management in the current state. But before that, we just wanted to quickly introduce Keenstack. You've probably all heard of ServiceNow, but we're probably a newer commodity. So again, Keenstack is a pure play ServiceNow partner. We operate in all four major areas that ServiceNow has from a partnership standpoint. So consulting and implementation, reseller, build program, which is really what this part is focused on. These are the products and solutions that we've built on top of ServiceNow and deployed into the marketplace. And then last but not least, we are a service provider for MSP services for ServiceNow. We'll go ahead and move to the next slide again. And then again, this really takes on addresses that first piece that Dr. Greg was speaking about, again, regarding the referral leakage percentage. Less than 35% of referrals actually reach a completed visit. And then from a quantifiable ROI standpoint, again, just under $1 million worth of revenue basically is lost through leakage per physician. So the idea is you move the needle 1%, 2% for your organizations multiplied by the number of referrals that you have coming in. There's millions of dollars of opportunity for you to kind of use to grow and honestly provide a better ROI on a solution like this that's built on ServiceNow. So not digging any further into this part, we'll move on to the next slide that talks a little bit about kind of the problem. And this is part of the issue that Dr. Greg was talking about, just more kind of laid out. This is a generalized workflow, right? From a community provider sending in a referral, either through email, through fax, or maybe you're pulling it off of EpiCareLink or Cerner Community View. And you think about all the steps and all the process that a referral coordinator or your team has to go through in order to get that referral from the point at which you got the document to the point at which it's in the EHR and you're actually scheduling the appointment. So we'll just move to another example. Again, if you're a post-acute organization, different EHRs, but same concept, right? It's still community providers. You may have health systems referring into you as well. A lot of the same type of workflow, different EHRs on the back end, but again, it's still that same middle piece, the same challenges, some of the same workflows that you're having to navigate through, that your referral coordination team is having to navigate through. So on the next slide, we talk a little bit more about kind of what it actually is. And I think this is really important, that we're not a replacement for the EHR solution that does the referral management in your organization. We are a complementary function that really supports a lot of the upfront quality and validation aspects of those referrals. So thinking about things about duplicate detection, quality checks around does the actual referral itself and the attached documentation, do they align? Those are things that obviously putting a referral in that is for the wrong patient because the referring physician has mixed up the document is a PHI violation. These are all things that can be done and looked at. Being able to classify urgency of referral, either based off of what the notes are and the criteria that the referring physician has put into the documentation. And then also last, but being able to run eligibility and benefit validation before the referral even makes its way into the EHR for your referral coordination team to start working it. So again, these are the types of quality checks that you can run up front, handle the communication back and forth with the provider office agentically until the clean referral is there and available and can be loaded into the EHR for the team to begin working on scheduling. So if we move to the next slide again, this really provides that holistic view of what the orchestration that ServiceNow provides in the context of referrals might look like for an organization. You may have a document management system like OnBase. You may have an eFax system like a Consensus Cloud or like a WriteFax that you're using. And then you have your EHR. You may need to do a lookup through an EMPI system like an IBM Initiate. And then you may be using an eligibility product like a P-Verify or Availity or one of those other. Those are the tools that ServiceNow, again, given the workflow and orchestration tool that it is, can orchestrate referrals through all of those systems and ensure that the referrals that get put into the EHR have kind of gone through all the appropriate steps, including, again, from the document management side, maybe you're not posting the actual images into the media folders in Epic. Maybe you're just posting the URLs, and that can come out of the document management system, but be orchestrated by ServiceNow. So again, really fits to your organization, helps work through orchestration of all of those pieces that make a quality referral, and really helps reduce some of the burden on your referral coordination team so they can work the referrals that are of higher value to the organization. So with that, I think this is the last slide up. Sorry, one last slide. This is a high-level overview of what the system looks like and what it's built on. It's built on HCLS, uses the case management capability from CSM. It's focused, the main capability is the document intelligence, which is part of workflow data fabric. And then again, the Now Assist skills that we've built to help handle all of the agentic movement of the referrals once the data has been brought in. All that decision making is again built on the Now Assist capabilities that kind of leverage the knowledge base behind ServiceNow. But Ben, who's on the call, like as you mentioned earlier, is going to walk through kind of how this actually works in the wild, in the real world. So with that, I'm going to turn this over to Ben.
Okay. Thanks, Alevsis. Hey, everybody. I'm Ben Rice. I'm a solution consultant here at ServiceNow, and I'm going to show you now how AI-powered referral processing with ServiceNow and KeenStack works and how it can accelerate your referral processing. So we'll see, what I'm going to show you is ingestion of referral data from different formats coming in my example, perhaps from a fax, an eFax, WriteFax, whatever, and how we would get that data into what we call a case in ServiceNow. Then we'll see how an AI agent analyzes the data that came in and compares it to a policy document stored in the system in our knowledge base, then decides what to do with the referral and performs automatic follow-up actions. Along the way, I'll show how this is all configured really quickly with natural language. And finally, I'll show you some patient records in our CRM workspace, which this is built upon, as well as a dashboard that shows you some key process indicators. But before I jump to the demo, I want to take a minute and just tell you a quick story about my friend Jessie, who is an informatics nurse at our local hospital. She asked me last month what ServiceNow does, and I gave her my short answer. We automate tedious work for people so they can focus on their real work. She said, wow, that sounds really cool, but can your system enter referrals into Cerner for me? I have to do like 15 to 20 a day that come in on the fax, and it's such a pain. So I said, hey, let me show you a demo. And she said, after the demo, It was about a 10-minute demo. She says, how do I get this? This would change my life. So I hope you'll agree with Jesse after the demo I'm about to show you. All right, so let's see it in action. Okay, let me get my screen up. All right. So what you're seeing here is a list of referral cases that have come in previously with some summary information on them displayed in our workspace. So this list is sortable, searchable. It's easy to export if you need to, like to an Excel document or PDF or whatever. But again, this is just a list of past referrals that have come in, their statuses, who the patient is, the specialty of the referral. It's all in this one workspace. So I'm going to create a new referral here just by clicking this new button, and I'm going to upload a document that might come in on the fax. And what I'm going to then show you is how our AI extracts all the data out of the document that I upload, and no matter what the format it is that it comes in, and it's going to organize it in this referral case. Then an agent is going to analyze the data. An AI referral agent is going to analyze the data on the case and give us a decision on what to do next. So we may need more information from the provider if it's incomplete, or it might be approved as submitted. I'll show you both situations. Now, this can be hooked up automatically to create these. You know, no one has to come in here and just press the button. But we'll hook it up automatically in production to create these from like an inbound eFax referral queue. You know, it's going to be monitoring that email box, or you can even integrate it via API into other electronic systems where you may be getting your inbound referrals from, depending on your business. But in production, these referral cases will just automatically flow into the system, and the agents will just start to go to work on them, whether a human's involved or not. And they'll ingest that data, analyze it, and take action, and then route it to a human maybe if they need to get involved. And then once the referral goes to an approved state, this system can even automatically push it to your EHR system, like Epic or Cerner, via an API. I know that KeenStack is working on that for the next release, various integrations into the EMR, and they've already been had some success with that. So, but this whole process that I'm going to show you could be completely automatic when you get a good clean referral. So I've created this. This is a brand new case I created. So all I'm going to do is attach an example referral document. I'm going to say it's unstructured. I'm going to pick an unstructured one here. And then just all I'm going to do is submit the case. So you can see here, we have a lot of blank fields here right now because it's just a brand new case. It's empty. And what we're going to see is when I click submit, the AI is going to swing into action. You can see it's still kind of empty. It doesn't know, but it's working in the background. So again, I'm not going to have to use my eyes and keyboard to tediously type it into the EHR, you know, off of like looking at one screen in PDF and then typing it into the EHR as I enter the referral in. So whatever the document format is, it might be structured, it might be unstructured, it might be from, you know, Mills Family Practice, it might be from anywhere, right? Whatever that is, our AI is going to figure it out. It's going to grab the last four of the SSN, the date of birth, the name, the reason for the referral, the doctor notes, everything that's in there. It's going to grab it and store it in the fields of the record that I just created. So if I click refresh list, we'll see now it's identified the patient as John Snow, and it's set it to a state of awaiting information. So why did it do that? Well, it didn't have enough information, and it bounced that off of the policy document. But before I open that up and we look at that referral, I did want to just show you how we do, you know, the two-step process. There's the data extraction. That's in what we call our AI data extraction. It's a document. It's created in here as a document task, but it's fully automated. And you can see it's actually, I think we specified about 43 fields when we created this. Actually, KeenStack already did that work, but you can see the values that it's pulling in and the fields that it's looking for. So you define, I need to find these 43 fields for a referral, and then the AI just kind of figures it out. So if it doesn't find everything it's looking for that you specified, like all 43 fields, and we can see here it found quite a few of them, and it might be, but it wasn't enough. The data it found in this unstructured referral was not enough for it to say, hey, this is good, this is sufficient, we need to send this to scheduling now. But what this can do is it can either go straight through and say not enough information, or it could even route this document task to a queue for a human to look at, and then they could use this viewer to go through it and see, it's pointing me right at where the data it thinks it's identifying is in the document. You can see the little highlighting here. Dallas is the city, street address 7210 Clover Ridge Road. I can flag this for follow-up. I can say, hey, this is truly missing in the document. I wasn't able to find it. The AI wasn't able to find it. And then you can move on. But so this is pretty cool how this just sort of works. So I'm going to get out of that and go back to the case and review that. So, but it's a really powerful capability. And then I'll show you how that's configured real quick. So here's the case. Now it's all been populated with that that unstructured document that you see here that was attached. And so what has the AI done? It's the agent swung into action, and it's after the data was all pulled in and filled in here, we see the referral details, cardiology. So what we've defined in this AI agent, AI referral analysis agent, is we've told it what to look for, that it should go grab the knowledge article that applies to this specialty that has the criteria that we need. And then look at the data that was ingested and then tell me if anything's missing, right? So here it says we have missing information here. There's no history of cardiovascular disease listed. There, an ECG was not attached, right? That's not in the referral. And how is that done? The AI agent actually grabbed the right cardiology referral guideline and said, here are the required criteria. And now it says, oh, some of these are missing, right? All of these would be required. Some of these are missing, so we can't approve this as submitted. And this is why. So it cites its source of the document driving it, and then it gives you the reasons why it's put it to a state of awaiting information and not just approved pending scheduling. But the cool thing about this is it's just doing a lot of work that previously heretofore would have to be done completely manually, eyeball with your eyeballs and hands on keyboard and swivel chairing between screens. So, and at this point, the other thing ServiceNow can do is automatically send an email requesting the additional information, the missing information details in an email template. It could just auto send that out to the referring providers this email that came in. So again, that's another place where you'd have to swivel chair to Outlook or your email program and send that email and then monitor that coming back to you, right? And then open the system back up. You don't have to do any of that anymore. Another thing, since this is built on our CRM system, we can get right to like the patient record here and see all of their information and even open that up. I'll show you that in a better workspace a little bit later, but we can see, oh, this patient has had 18 referrals in the past. So you have at your fingertips an interconnected system where we can get to everything from everywhere else. So again, what I'm gonna do now is actually create another case, right? So we're going to go back to our referrals. And this time I'm going to use a different document and we'll see a different outcome on that. So we've got this one, we've created a new case. We're going to choose this time the structured dermatology referral and see how that looks. So if I save this and look at this document, what does this one look like? This is a completely different format. And the same AI data extraction is going to be able to handle this no problem. It's just you're describing to the AI how you extract the data out, and it just does it. It's really fast time to value to create this. And you can see, as you can see, it's already worked and populated it. It's that fast. So in this case, it's approved pending the scheduling. So it found everything it needed. There was nothing missing. And that was using this dermatology referral guideline. So again, the agent went and did this and said, oh, based on the specialty, I'll grab the right policy document and make my decision based on these required criteria. So it's very powerful, very quick, and it's just taking a lot of manual work off the plate of like in the case of my friend Jessie. She's an informatics nurse and she spends hours doing this stuff. So let's very quickly look at the document extraction, how easy this is to set up. We're looking for 43 fields, right? You might be looking for other fields or more fields, or you might need to modify this in the future. It's very easy to do. You just click into, you specify, you add what fields from our data model you're looking for to populate, and then you just specify it's the patient first name, it's the patient's social security number. You can get really detailed when you configure this, and it gives you guidance, and give it examples like routine, semi-urgent, urgent. And that's all the AI needs to extract data from all these different formats. We're just using this one definition, and this is enough for it to really work well with those two formats that I showed you. So this is a huge leap forward with the new LLM stuff, that we're able to leverage this and embed it in our system and really get fast time to value with document extraction. So natural language to describe what you're looking for, the AI takes care of the rest. To look at how that the referral analysis AI agent works, again, it's just as easy. You created this Now Assist referral validation skill for it, and now you're specifying in this prompt, you're telling it what to do in normal language. Identify the appropriate medical department, calculate the patient's age, retrieve the most relevant knowledge article. These are our policy documents that we upload, right, that tell us the criteria for approval. Upload those, analyze those, compare each individual requirement strictly. And I believe this comes with this comes pre-configured with KeenStack, but then you can riff off this, modify this, extend it, add new skills, follow this pattern. But it's very straightforward to do this stuff, and it's easy to maintain going forward and expand upon. So then you just give it more instructions, evaluate each requirement individually. If any one requirement is unclear or not supported by the data, mark the referral as incomplete. You can even add instructions here to say, verify the integrity of all the data in the referral, make sure that it all hangs together and that you don't have mixed data from two different patients in case somebody in one of these offices put pages from two different referrals together mistakenly. It can even analyze that. You can say, make sure all the data is consistent with the record we already have on file of John Snow. And it can even do that, right? So it would give a message back about that. Output instructions. This is what it should put on the case in the various fields. If all requirements are met, state should be updated to approve pending scheduling. If requirements are not met, set it to awaiting more information, and then give us an out, and then you're even telling it what format to generate the output with. So you're going to give it a list of evaluation results. Again, you're just describing to the AI what you want it to do, and then it just does it. It's ChatGPT, it's Claude. You guys choose what model you want to use in your ServiceNow system, and it will leverage that model and use these prompts to drive it. So it's as easy as that. It's really easy to maintain, and we've just found it to be a game changer. It's really, really changing how quickly people can get real action, real automated action happening in the system. So let me just test this really quickly, just right in front of you. So I'll just take that case that we just ingested. I think it's 1278 would be the one. That would be this first one I did. So if you're modifying this logic prompt and you just want to see how's it working, this is the one that I did the first one where it says requirement. Oh no, this was the dermatology one. So all these requirements were met. None of the requirements are unmet. We could run the test again, do it with the previous one and see an example of it not being met. But it's very fast, right, to do this testing. So we see this one was not met. This was the one for cardiology. No information in the doctor's notes about the patients. We're going to need that if we're going to do this referral. So this is the output of this one. So again, it's that fast. And then once you set this, it's like set it and forget it, right? The AI agent is just always operating. Whenever a new case comes in, it's going to ingest the data, and then it's going to run this analysis to your specifications, and it's going to make a decision based on that.
And knowing, Ben, this metadata is really helpful to say for compliance purposes down the line around the overall behavior and the decision making around the agent. So this provides a level of, like I said, compliance and follow-up that if you want to go back and see why did it make this decision, you can go back and look at the metadata that was generated from the AI utility that was kind of navigating through this particular referral.
Exactly right. That's a great call out. And you'll always have the reason why you delayed the referral. Right, exactly. That's a really good point. Okay, so I think we've seen this in action. One other point I wanted to make is that this is a CRM system. It's built upon that, so it's not just under the hood processing going on. So if you want to have this in your used in your call center, you can use this system in your call center, and you can actually look up your patients, right? You have healthcare data here. You have your whole list of patients. So if I open up one of my patients, I can pull together right here in all of these panels, all the patient's information if it's useful, right? If I need to have a communication with this patient, all of these panels can be populated by zero copy connectors from your core EHR, whether that be Cerner or Epic. And this would be, the customer facing system, right? You might not want to have all your agents using the EHR. You might want to pull it in here, but it's zero copy. This is not the system of truth. This is just a way to pull it all together into a useful 360-degree dashboard for your patient, for your agents to speak with your patient, your customer facing people to speak with your patient. We can see the list of all the referrals that they've had in the past and drill into those and see historically. It even has the ones I just did all in there. For John Snow, I can go in, I can look at Clara Davis. She's got a different profile, right? She's got no conditions, no medications, no allergies, no immunizations, which she's only had 8 referrals. So this is very useful. It's all in this one system. And it's just really, it's a one-stop shop, really. The last thing that I was going to cover You get a live dashboard. You can create more. You can have as many dashboards as you want. This one, this would be great for your leadership to understand the workflow performance in a summarized fashion and where things are flowing and where things are going, with your key process indicators. So this one's got 6 reports broken out on it. We can see how many approvals we've approved, how many referrals we've approved so far. We see how many referrals were submitted for brand new patients, total referrals submitted by medical specialty, incomplete referrals if we want to focus on that, and then open and active referrals that haven't been closed out yet. This is a live data dashboard, and any time you can just click on any of these panels, and then you can instantly pull up the list of records, right? So you can get right to the live data, which is really amazing. A lot of other people do reports and they just can't get to the data. This lets you drill right in. But here in the middle is where we see the real value of this overall system. The average processing time from when the referral hit our system, it came in on that email, to the actual, decisioning of it, the setting of the outcome status, and execution of follow-up actions, like maybe that follow-up email to the provider for more information. 49 seconds. That's really, really fast to compare to, imagine as each referral comes in on the fax, I've got to comb through it, find each piece of data, and then type it into the form in the EHR in a swivel chair fashion. That you just can't compete with this, right? This is going to do it in computer time, in agent time. I mean, the agent even went out to the knowledge base, found the right referral guideline out of potentially lots of ones to open up, whereas a informatics nurse would have to go to SharePoint and find the right guideline and then pour through that, make sure the data has integrity, compare the data in the referral. Do I have everything I need? Have I met all the requirements for us to schedule this referral? This is going to do it far faster, than laboriously typing the data into another system. So ultimately, what this system can do for you is eliminate a lot of tedious, error-prone data entry and swivel chair work, and let your nurses get back to focusing on their highest, best work, which is caring for patients. So thank you for watching my demo. Alexis, Patrick, Dr. Greg, back to you. I don't know who's doing the closing remarks, but that's what I had.
Well, I wanted to add one thing, Ben. I think the focus touching on the integrations, because I think those are so important as well. Although we haven't packaged the integrations with Epic and other EHRs into the marketplace app that's available, we do already have the production of all the HL7 V2 messages that are required to actually get the referrals into the EHR. And we have all the FHIR APIs that are required for things like patient lookup, in order to be able to, again, look up the patient and ensure that, do we know that this is an existing patient, and attach IDs associated with that patient. So then when we do move the referral into the medical record, that it's not whether it's an unknown or new or an existing patient. Other integrations have already been built out with the eFax providers and, like I said, eligibility vendors. So if those are things that you're interested in, although they're not in the packaged solution that's already deployed to the marketplace, those are things that will come in subsequent releases. But from a services standpoint, we have that capability as an integrator to help expedite the implementation and integration. So wanted to make sure that everyone kind of was aware of where we're at with the integration side of things and what we have available.
Yeah, thank you, Alexis. I think one, kind of a follow-up question on that would be a common thing we hear when we show a new application to our customers is, what can we expect from time to value, right? If we decide we want to go down this direction, how long before we're up and running and operational?
So I think that's a loaded question, and that I know we've heard that it really depends on how many different integrations that you want to have. So for example, if you want all the images to flow into a document management system and then just have the URLs published into the EHR, or whether you want to move the documents in, whether you have web, maybe you are a system that has referral forms online and you have hundreds of them for all your specialties that you need to have replaced and built out on this one. So it just depends on your specific use case. But in general, that's where we can, again, if you do have an interest on what the effort and time takes for your specific makeup based on what the core product provides and then what the deviation from that is, that's something that we can produce and provide really real quickly once we get a little bit of additional detail.
Yeah, thank you. If there are questions, please do use the question and answer section. I have put my email address in the chat there. So after the fact, if you want to reach out and get started, or if you have questions, you can reach out to me directly and I can help coordinate that. Not seeing any questions. Ben, do you want to do a quick recap?
Yeah, absolutely. So I believe, what we saw is ingestion referrals, right? And again, I want to point out that with the integrations, that can be happening fully automatically once you went to production, right? Whether that's integration to WriteFax, eFax, web forms coming in. Again, it's a CRM system, so we can deploy portals where you could even have, your small satellite practices or other practices that refer to you. Enter that referral in a form, so it's standardized and it just comes into the case. And you can even pull them from. We have a home health provider that's going to be using us to pull from the various electronic referral systems that they pull from, like Allscripts, various other electronic referral platforms. And then we saw so we can ingest that data, get it in. And once we have all the data that can be gleaned from the referral, now we have these Now Assist agents that analyze the data that we have gathered and make decisions against policy documents that you've uploaded to our knowledge base that specify what to do with a referral. Here are the requirements that need to be met. If they're not met, we need more information, or even just doing the data integrity, right? Did some data get mixed together from two different patients by accident? Unfortunately, especially on a fax, right? You could have where it's pages being shoved into a machine in some cases. This comes with a canonical healthcare data model. We can encrypt this, because it's PHI. There can be any level of encryption you want, all the way up to our vault encryption on the instance to make sure it's safe and protected again, that only the right roles can see it. It'll be obfuscated from some roles and available to be seen by people that have the proper roles. And then workflow routing and automation. We can even introduce into that case, we can introduce a thing we call playbook, which will guide work if downstream work needs to happen, downstream to-do tasks need to happen. We haven't even gotten into that just because we feel like this AI piece, this automation of the ingestion, analysis, and approval is just such a big lift. But that would be a great big initial lift if you only did this and took the referrals and were able to approve them whenever you can and push them into your EHR. That would just be a huge lift in some of your larger hospital systems that have a lot of referrals and have a referral problem. And then you have the visibility and the transparency with the leadership dashboard. So I think that's what we covered today, but we really feel like, again, for my friend Jessie, it'd save her a couple hours a day, and she's just one person at a smaller health system hospital. I'm sure there's many Jessies out there in all of your systems that could use those couple hours a day back and not feel like they're data entry people. I don't think we should be having nurses do that. So that's all I've got, Patrick.
Yeah, well, thank you, Ben. Not seeing any additional questions, but still some time if anybody wants to put something in. want to thank everybody for joining us today, and hopefully you're excited about the new offering and how it can help your organization automate intakes, reduce leakage, strengthen provider collaboration. Again, this session was recorded, and I'll be emailing a link to you in the next about 24 hours. So please feel free to share that recording with others in your organization that might be interested. If you are ready to dig in and learn more, you can reach out to me directly. Again, I put my email in the chat, and we can work with you to further evaluate the solution. We can work with you also to provide a proposal, including a business case with an ROI analysis ROI analysis for you to consider. Alexis presented some data at the start that will drive how the ROI is developed. So with that, again, I want to thank you for joining, and assuming there's no other questions, I'm not seeing any. Want to wish everybody an excellent afternoon.
Thank you.
Thank you.
Thank you, everyone.